Hi, my name is Marcus Garcia, and I received the PhRMA Foundation Scholarship in Translational Medicine, and I'm currently at the University of New Mexico. I always had an interest in reproductive health, just because that was something that really affects my family. Our family on both male and female side have a lot of infertility or problems bearing children overall. When I was first an undergrad, I got introduced to more of the genetic components of reproductive health issues and was luckily enough to get introduced to a lab at that time. And that actually started my whole journey. When I got into pharmacy school, thankfully enough, meeting with my mentor at the time, there was an interest in what I was doing, and we really developed an entire pathway around reproductive health, more on the cardiovascular side. When I graduated, I did more of a pharmacy clinical fellowship, and then now moving forward, going to be doing more on the reproductive health side, looking at the effects of microplastics on overall health, how they're affecting the environment, so continuing to move that forward.
We've been dealing with an international issue around microplastics for quite a number of years. We started to see more interest in marine life and what's kind of going on because they're living within that on a daily basis. What's going on within our bodies, or is it affecting humans in any form or fashion as well? Whenever we're looking at human impacts within microplastic contamination, this is a very new area, so there's a lot of unknown answers to that.
So my research is primarily focused on how to adequately quantify microplastics in biological tissues. Now, how we ultimately do that is we can take any tissue, whether that be preserved or fresh tissue, and we are able to isolate microplastic pellets out of that. And then what we do is we use a technique called pyrolysis gas chromatography mass spectrometry. And with that, what we're able to do is we ultimately combust that pellet. And what it does is it actually forms a fingerprint of all of the different microplastic components. So just to give it a couple examples, polyethylene, polypropylene, nylon, polyvinyl chloride, those are some of the ones that we're able to identify. Within our library, we can currently identify 12 known polymers as well. With this technique, it's the first time we were actually able to say, this is the exact amount of microplastics of those specific different ones of interest. And based off of that, then we can use that towards clinical data to say if there's an increase in these microplastics in certain tissues that we're interested in, and what kind of clinical health outcomes are associated with that as well.
Being able to look at the human placenta, or even just placenta in general, and see how these microplastics are being translocated into those. What are things that are occurring within the placenta, or even being transferred into the babies that may be of potential risk. So those are going to be the big questions that we're wanting to answer.
Having great mentors around you, having people who are very like-minded in terms of the type of research that you're doing, the opportunities that not only collaborators from other institutions, but also within your own institution can provide. I think that those are going to be some of the biggest things that have helped me build my career. So for me, my future career aspirations would like to be an assistant professor within our R1 research institute, seeing not only the PharmD students, but also our PhD students that we have, and see how they can continue to grow and develop into their own as they move forward as well too, is something that's really inspiring to me. And if I can play a small factor in helping them develop their career, that's something that I'm really excited about.